Hi, welcome to the Tiny Tot Parents channel. This is the episode 4 of our infant feeding video series. And if you're new to this, here is a brief recap. If you'd like to watch the earlier episodes, I have put the link in the description below. In the earlier episodes, we covered why breast milk is the gold standard and the real challenges of breastfeeding and the standard formula as a default for healthy babies who aren't being breastfed. Today, we'll go deeper into the formula shelf, into the specialty formulas, your anti-reflux formula, comfort formula, lactose-free formula, and the ones that are marketed to parents of fussy babies, gassy babies, and the babies who regurgitate and vomit. Are they actually solutions? That's what today is all about. My name is Dr. Shivashankar, and I'm a neonatologist. First, let's look at the anti-reflux formula, the formula that's being marketed for babies who regurgitate or vomit. First, a quick reality check. Spitting up, what the doctors call reflux, is incredibly common in babies. Most babies do it, and most of them are completely fine. Yes, it looks dramatic and it can ruin a lot of clothes, but it usually doesn't bother the baby anywhere near as much as it bothers the parents. In medical terms, it's called physiological reflux. It happens because the valve between the baby's stomach and the food pipe, also called the esophagus, is still maturing, and it usually settles on its own by about 6 to 12 months. It's not a disease. So, what does the anti reflux formula do? They usually contain a thickening agent like a rice starch or a corn starch or something called as a locust bean gum. This actually makes the formula thicker in a baby's stomach so it's less likely to come back up. Does it work? Yes, it reduces the visible spit up. Mothers using it generally report less laundry. But here is the important question. Does it actually make the babies healthier? Does it improve the growth? Does it improve the long term outcome? The answer is no. Anti reflux formula reduces what you can see, but it doesn't change the underlying biology. Your baby's stomach valve is still going to mature on its own timeline. There is also one situation where anti reflux formula is the wrong answer. If a baby has got a pathological reflux, which means a real reflux disease that's causing pain, poor weight gain, breathing problems, blood in the vomit, etc., that needs a proper medical investigation. And it's not a job for an off the shelf formula. My honest take is if your baby is spitting up or vomiting but is gaining weight and has wet nappies and seems to be content between the feeds, you don't need to do anything. They'll just grow out of it. Now, comfort formula is the one that is marketed to the parents of unsettled, fussy, possibly colicky babies. And the implication is that switching to comfort formula will calm your baby down. What's a comfort formula? It's a standard formula with a protein partially broken down. Imagine taking the protein and coarsely chopping it into smaller pieces. The idea is that smaller protein fragments are easier to digest, which might cause less tummy discomfort. Some parents do report their babies are calmer on it, and other parents saw no difference at all. So, what does the actual evidence say? In multiple research reviews, comfort formula has not shown consistently to reduce fussiness, crying, or colic. So, the evidence is quite inconsistent. Some babies do better on it, and some don't. And here is the single most important thing to know about the comfort formula: it's not a treatment for cow's milk allergy. The protein fragments in comfort formula are still large enough that the baby's immune system can recognize and react to them. So, if you suspect your baby has a milk allergy and you're switching to comfort formula thinking that it will fix it, we are taking a risk. A baby with a real milk allergy will keep reacting. We'll talk about the real milk allergy and the proper treatment in the next episode. If your baby is genuinely just a fussy baby, colic happens and it almost always settles by around 4 to 5 months. Comfort formula might help slightly or it might not. The harder truth is that there is no formula that reliably fixes a fussy baby. Most fussy babies just need time. The next one is lactose free formula. When do you actually need to use it? Lactose free formula is a standard formula with that natural milk sugar, which is lactose, and that is removed and replaced with another sugar, usually maltodextrin. Should you use routinely? No, almost never. Here is why. The true lactose intolerance, the condition where the baby cannot digest lactose from birth, is extremely rare. It's not a normal cause for fussiness at all. A more common situation where a lactose free formula is genuinely useful is after a bad stomach bug. When a baby has a gastroenteritis, the temporary inflammation in their gut can briefly reduce their ability to digest lactose. And in these situations, a short course of about 2 to 4 weeks of lactose free formula while the gut recovers can be helpful, particularly if the diarrhea is persistent. After that, you go back to your normal formula. It's important to remember that routinely using lactose free formula without a reason actually has a cost. Lactose is a natural sugar in both the breast milk and the standard formula for a reason. It helps your baby absorb calcium. It provides sugar called galactose that's important for your baby's brain development. It supports the growth of beneficial gut bacteria. So, when you remove it without medical reason, you're removing something useful. So, unless your doctor has specifically recommended lactose free formula, please don't switch to it. So, to summarize, anti reflux formula reduce visible spit up, but they don't change the outcomes. The comfort formula may help, but it has inconsistent evidence for fussiness and it is not hypoallergenic. And the lactose free formula is for short term use after a stomach bug and not for routine use. And constant switching does more harm than good. In the next episode, we'll tackle a bigger issue: what to do if your baby actually has a milk allergy, how to spot it, how to tell it apart from a normal baby symptoms, and the proper hypoallergenic formulas that are designed for use. If this was helpful, subscribe to the channel. Until next time, take care of yourself, take care of your little ones, and I'll see you in the next one.